invitation.
I'm inviting Dr. Jagat Mohini call. You are invited for 4 o'clock guest lecture of IM.
I'm waiting for the link, sir.
Link.
Waiting for the link.
So, hello everybody. Greetings from Heartcare Foundation of India. You are you are invited for today. We are welcome to 30. This is our 36th meeting of Heartcare Foundation of India Roundtable. Every week we talk about something new and update you about what has happened in the last 1 week. Today's topic, Dr. Kalra is going to introduce, is something different, where we would like to know personal stories of each one of you. Dr. Kalra.
Thank you, sir. We all are facing the COVID-19 crisis for almost now 10 months in India. And everybody has faced challenges in the routine day-to-day life activities as well as the professional in the career also. Definitely, everybody need to come out with some experience, bad or good, because it's not only all bad, but COVID has given a lot of opportunities also for learning in a personal life as well as in professional career. So today, I will request all the members to share their experiences in their personal life as well as in the professional life, all goods and bads, what challenges and opportunities they have shared. A rough format already I have circulated in the WhatsApp in the morning today. I will just briefly, in the personal life experience, what is your initial perception with the onset of COVID crisis? Then home office means work from home. What is your experience and how much it has affected, or what is the impact of this work from home on the efficiency? Restriction on the travel or even ban. How do you feel about that? Then job security and then digital platform, including social media. And in this, even it includes the online education. Any opportunities or advantage of pandemic for you, any new hobbies, exercise, yoga, or any other thing which you would like to enumerate? And what is your view about stigma, then fear, anxiety, or mental stress? What you have to say about that? Will you get yourself vaccinated? If yes, what type of vaccine? Then relationship. Is there any good or bad impact on the relationship among your family members as well as friends and the society? This was something about a few things for personal life experiences, then professional experiences, communication, the enhanced, or you feel there were less communication from the healthcare providers or your colleagues regarding news, updates, tasks, duties assigned, etc. Then enhanced awareness regarding PPE, donning and doffing, and infection control prevention and infection IPC practices, then simulation and upskilling, the ambiguity arising due to modified treatment protocols and guidelines issued by the government, any burnouts if anyone has experienced, then what do you say about digital conferences, CMEs, webinars, then minimum physical contact time with the patient and the families, impact upon your practice, are we prepared to face future pandemics, perception regarding healthcare providers or healthcare industry. So these are the few points I just thought everyone to share in 5 to 7 minutes their own experience. Anything addition to these points which I had enumerated, all are welcome. So now over to Dr. K.K. Agarwal.
Thank you, Dr. Kalra. My first duty is to share what is happening in the world before we start on today's topic. So this is the word pattern. I'm only taking today the top 10 countries and their status and the top 10 vaccines on the fray. So I'm not taking anything more than the top 10. This is the word pattern. And if you see, the mortality was low, but after that, mortality is now constant. Number of cases and mortality patterns are same. Number of cases are increasing, mortality is also increasing. This is the original company, China, the mysterious country. Still, we don't know how they have been able to manage 0 cases and 0 deaths. I mean, you can see it looks like that something is there that they have been able to manage, which other part of the world doesn't know how to do that. Now, starting with on the list, we have USA on the top, third peak, and mortality is also not like China. They have not been able to control the mortality as China has been able to do. So there are 3 peaks in USA. Number 2 country is India. And if you see in India, we expected India to have a second wave before a second wave to become 0. But if you see in India, suddenly the cases has become stationary. They have started reducing, now has become stationary. So is the mortality. Brazil is showing the same pattern, but the cases are going down, and suddenly the cases have started increasing in the last 1 month. Russia, you can see a pattern, 2 peaks of the first wave, like USA. Mortality is dependent on the number of cases. France, you can see this is a second wave. This is not a second peak because there are cases in between almost 0. So France is showing a second wave. All other countries are showing a second peak. So this is a second wave. Number of cases are increasing, deaths are reducing. Then on the list after France is Spain. You can see number of cases, again the second wave, number of cases are increasing. Mortality is hardly any. They have been able to control the mortality. UK also a second wave, mortality they have been able to tackle. Italy has not been able to tackle their mortality. The number of cases are increasing, so is mortality. Argentina is having mortality and cases are behaving the same way. And the 10th company is Colombia, is showing some reduction in mortality compared to the number of cases with that. This is what I wanted to share. I come back now to the 10 top vaccines. The 10 top vaccines of the country, of the world. The first vaccine on the fray, when I say 10 means phase 3 trials. Apart from that, I must tell you there are 2 vaccines which have been approved so far. Let me start with the vaccines. That is Sputnik 5 and Russia Epivac Corona. 2 Russian vaccines have been approved by Ministry of Health of the Russian Federation. Means these are not EUA. They are completely approved. And now August 11th means they have a 3-month data of after approval, which is showing efficacy. The second vaccine is Epivac Corona. That is a synthetic peptide antigen vaccine, which is being granted permission in Russia. This is one thing the world has seen. Even company like Oxford can make a mistake. That means more than 2,000 people given a wrong dose of vaccine. So imagine vaccines coming from all over the world may not be reliable. And the Oxford have admitted that they can make a mistake, major mistake of a dose. Another thing is the US FDA on 2nd of November have said that rapid antigen positive can give false positive. Up till now, we were very emphatic. Positive means positive. But this statement of 3rd November came to my knowledge only 2 days back. Nobody is talking about it. Nobody is creating an awareness about it. That US FDA has issued an alert that rapid antigen tests can have false positive results, which I am sure even the RT-PCR, I have 3 examples where it has shown a false positive results. So false positive cases are occurring. So therefore the roundtable members must know that if you get an asymptomatic positive, it may be a false positive. WHO statement on its website, WHO says, I do not recommend rapid antigen test. Coming back to another concern before I give the top 10 vaccines. The first concern is all these vaccines are saying that they are not preventing symptomatic disease. Remember, the 10 vaccines which I am going to talk about it, nobody is talking about prevention of asymptomatic disease. So they are only saying that after our vaccination, 95% of the patient did not develop symptomatic disease. So if they are developing asymptomatic infection and transmitting it to others, nobody knows. So these vaccines are of personal use. They may have no value of a public health importance because nobody is talking about asymptomatic infection after vaccinations. This is a major thing which people are withholding and nobody is talking. No country is talking. No statement has come from Indian government that we are not even checking asymptomatic transmission. So they are only checking symptomatic disease. In any way, 95% of the disease is asymptomatic. If this vaccine is causing asymptomatic infection, nobody is talking about. And nobody is also talking about secretory IgA because all are talking about this injectable vaccine, prevent symptomatic infection. Nobody is talking about, is this vaccine producing secretory IgA? Is this vaccine preventing GI local disease or not? Because this is a mucosal vaccine, you may end up into preventing a systemic disease, but not a local GI disease, which happens in 40% of the cases. And the third thing is that there is going to be a strong reaction. The Brazilian president say, I am not going to take it. I don't rely on any vaccine today. And the former vice president of Pfizer says vaccines are not required. So these two big statements are going to add confusion into the whole thing. Now I come back to the first vaccine is Oxford vaccine phase 3 will be available on 10th of December. Now, this will be launched within this month, will be given a clearance by the EUA of British company, British regulators. Every country today will like to take a political credit of launching a vaccine in 2020. This is their political compulsion. So therefore, this vaccine will be approved in India in December. India has already said, if UK clears, we will clear it automatically. So this Oxford vaccine in India, the first dose will be given to somebody within December. That means people, political claim will be, we brought the vaccine the same year. This is Pfizer vaccine, which will be launched in USA on 12th of December. And most likely Pfizer will like to launch it in various countries. Maybe Pfizer also may get the nod, but if India gets the nod of Oxford, then India is not interested in bringing Pfizer in December. Third is Moderna. Both of them will be available in USA from 12th of December. The fourth is AD5, that is adenovirus 5 human virus, which is from China, which is running a phase 3 trial. This vaccine will be available, may be available in China, Bangladesh, Malaysia, Pakistan, those countries who are dependent on China, supported by China. You will get adeno5 virus may be applicable there. Inactivated vaccine, which is Sinovac from China. Already 10 million people have been vaccinated in China. It is a EUA in UAE. And this is likely to come to Bangladesh, Malaysia very soon. Will get launched. I mean, respective countries will have to decide when to use it. This is inactivated. This is Indian inactivated Covaxin. I am still feeling India should have launched it after the phase 2. I saw some news that India is considering launching this. If they launch it after phase 2, they will not be wrong. They will not be politically and scientifically wrong if they launch this vaccine within this month for selected people. Johnson & Johnson vaccine is adenovirus 26 vaccine. A lot of people having an eye on it. They feel this vaccine is also going to be in the top 10. This is already in the top 10 and will be available in various countries. Inactivated, another vaccine by China. They have not yet named, same company Sinopharm. But again, this will be like 2 inactivated vaccines from China. This is Novavax. US is putting a lot of hope on this particular vaccine. This is a nanoparticle-based vaccine. This is a recombinant nanoparticle technology to generate antigen. If this is successful, I think this will be a game changer because this is also a recombinant technique like Moderna and Pfizer. And if it is positive, it may also give you 90% effectiveness. So for A20 countries, the top 20 people of the country, I'm dividing it A20, B40, and M40. The middle income 40, the bottom income 40, and the top 20. Top 20 will give Moderna, Pfizer, Novavax. The lower middle companies will give inactivated, and middle countries will have to buy. Because they have to buy, they will have choices. Sputnik is the last vaccine on phase 3. Is going to be available all over the world because they have no controversy. So Sputnik 5 is now offering Oxford that why don't you use 1 dose of my vaccine and 1 dose of your vaccine? That's they have tried to, whether it is a sarcastic comment or it's a real offer, I don't know. But Sputnik 5 is going to be a game changer for India. In India, we are going to have Oxford, Sputnik 5, and Bharat Biotech as the 3 main vaccines to be implemented. That's what around the world in the last 1 week. Now we come back to our subject today. Sorry, I could not. Yes. Yes, Dr. Kalra.
Doctor. Dr. Bejan.
Bejan Mishra ji, start with your experiences.
Please, you take over the session now.
Thank you very much. Thanks a lot. Well, my short opening remarks as a citizen is that, this pandemic definitely got us into a very, very new kind of a culture, which is known as working from home and working in the virtual world, which has added a lot of value. Also, it has brought in certain constraints in terms of our work culture and in terms of our moving forward as a citizen. The biggest blow has been that a lot of people have lost their jobs. A lot of people are yet trying to figure out how to rehabilitate themselves. But one thing which has come out very clear is that technology has become one of the biggest enabler to a citizen. And in these challenging times, it has definitely provided some very sustainable solutions with all these kind of barriers which got created due to lockdown and due to all the precautions which the medical fraternity and the scientists recommended to us. But it has brought in a lot of anxiety. It has brought in a lot of tension. So my personal experience has been that relax, attend Dr. K.K. Agarwal's parvachans and all the scientists and well-known people who are discussing this in public domain virtually. So every day spend some time whenever you can to learn from them, and never get anxious and do not get perturbed. Try to lead a life which is normal. And the best part which has happened with us as patients group is we have been able to now look at other options in terms of your healthcare accessibility, and also bringing other options available in terms of making sure that we are able to keep ourselves healthy and manage this virus, which is an unknown kind of a devil which has come, which we never expected, but it came very suddenly. So having said all this, what we have been able to understand and what we as also patients groups are trying to do is to convert all these communications into a common man's language. We have also intervened before the judiciary, because many a times when we get anxious and we don't get responses from the administration or the policymakers or the lawmakers, then we do not agitate on the streets, nor we try to disrupt the daily life of people, but we go before the judiciary as per our constitution to seek justice, to seek our liberty, to seek our choice. So we have gone before the judiciary. Judiciary has played an excellent role virtually operating all the courts, and allowed us to get solutions to many issues which were unable to get solutions, and bring fast track kind of attention of the policymakers on certain matters like pricing, like accessibility, and like quality, safety. So as far as the vaccine is concerned, and all the data which Dr. Agarwal from time to time updates us very regularly, for which we are very indebted to him, and we feel very proud that at least he is being devoting so much of time to get us all the latest things. And he gives his own inferences also. Others in this panel also gives inferences which are very, very helpful for people like us who try to reach it to the people as much as possible in the manner it needs to be communicated in a language which a common people can understand. So having said this, we are still waiting to understand how the vaccine will be made available, when it will be made available, which are those vaccines which will be made available, how it will be made accessible, and through the media, with the help of media reporters who are constantly in touch with us, we are trying to reach out to the policymakers to ensure that whatever they decide, it has to be built on a consensus, and it has to, the major thing is it has to be for the health and safety of the citizens, which is paramount. So having said this, we are highly dependent on experts like you all who are in this round table, and we would like to get guided. And lifestyle has changed, and as Dr. Kalra has given certain questions to be answered, I don't know how many I was able to answer, but I have tried to answer most of it, which he has raised. And tomorrow, the new India, the new normal would mean that more technology, more empowerment, more choice, based on credible information, based on certain new laws which are coming in, like telemedicine, teleconsultation, all what is coming. We would need to develop standards, we need to develop protocols, we need to change our laws, and make sure that whatever we do voluntarily or mandatorily, they're all in the interest of the patients. With this, I would like to close now and request Dr. Kalra to take over and take it forward. Dr. Kalra.
I will invite Dr. Kaul to share her experience.
Good morning, everybody. It's a pleasure talking to you. My experiences have been, it's a mixed bag of experiences. To begin with, it didn't seem so difficult. It didn't seem so uphill. We felt, okay, it's going to be there for some time and it'll be controlled. We'll all follow all the norms. And then suddenly it just went on and on and on. And today, all of us are in a COVID fatigue zone. At least I am in COVID fatigue zone. But certain positive uptakes that I got from COVID was I learned to value many things. I learned to value family tremendously. I did make it a point to ring up a few people and tell them how much they mattered to me. I did feel a lot more affectionate towards my friends, towards my junior colleagues. I made it a point to try to ring up as many people as I could in a month's time or a week's time. That was a positive intake, but the WhatsApp University and the media, the television media, upsets me still. There is so much information floating that one is not able to sift anything out of it, what is correct, what's not correct. As Dr. Kalra has rightly pointed, the treatment protocols, I still share the treatment protocols, they are confusing. They are confusing and we are getting so much input that we don't know actually what's happening in the hospitals. The frenzy that the television creates about the shortage of the hospital beds, that puts so much scare. My relatives ring me up and tell me, would you be able to arrange an ICU bed for us? I say, please, can I arrange it for myself? I don't know that also. So that kind of pressure that has come on mind and this 65 plus pressure it's really not been a very easy path to tread. About mental stress, I think which one of you of us can say that there hasn't been mental stress? There has been tremendous mental stress. Some of us have been oscillating between bouts of depression and exhilaration, and some of us have been trying to rationalize our feelings. We have tried, all of us have tried to rationalize. If anybody says today that one is not feeling mentally stressed by the status of COVID in India, one would not be very accurate. We are all trying to rationalize it because we have no other way to handle it. Have we learned anything from this? Yes, we have learned that, yes, keeping yourself happy, exercising. Yeah, we have all become yoga fans. We all take long walks much before you should be anybody else is on the roads. We do all that to keep ourselves happy, but there's an underlying anxiety all the time, all the time. When I talk to you from a perspective of students are very unhappy. Students are saying that we are going to do final year without touching a patient. Ma'am, what are we going to do in internship? How are we going to ever learn proper examination? That is a worrying point. That is a worrying point, whether our students will be competent enough. When are they going to pick up those skills in internship when they are going to be studying for the PG examination? It's worrisome. Both teachers as well as the students are worrying about it. Online classes, I'm telling you true incidents. Online classes, my students ring me up and say, ma'am, from one side, my mother is feeding me parathas and I'm listening to lecture. It doesn't make sense to me because I'm not able to concentrate. They are trying, but let's accept it. Teachers are doing a wonderful job, but the uptake in students is not that much. They are not really keeping up with that, whatever is happening in the classes, although they are trying. But we all know the attention span in front of a computer, unless you're involved in that, is not great, I don't have experience of treating patients. I'm not in that field. But I also know that the stress in medical colleges is very, very high. All our residents, I'm in touch with lots and lots of my younger people, younger colleagues. All of them have a certain amount of stress, which has almost become inherent to their personality, thereby are little more irritable, are little less sensitive to other people's needs. There is always a little selfish angle that comes before self, before anybody else, which I have noticed in myself also, that I would look towards my safety first before seeing whether I'm doing the right thing by the next person. So these are kind of things. Travel has become totally restricted. We are missing our children. Children are outside. There is no, except for FaceTime, which is a boon. The technology has been boon. There's no contact with family. Unfortunately, there have been deaths in my family. Is it not, it's difficult to explain when your sister loses her husband and you cannot go and meet her. It gives you goosebumps. These are the kind of experiences that many of us have gone through. 7 to 8 members of the family suffering from COVID, and you can just not hold anybody's hand. You can only just be on FaceTime with them. So things have been not so good, at least for me, and my personal experience has not been extremely positive. And the take is there's a lot of stress. We are getting too much information, which is then modified by the TV anchors into their understanding of the information, which is very sad, which is extremely sad. And a lot of doctors who come on to give their expert opinions don't understand the question, don't answer those properly, which is again very sad. So we are left with information which is really not helping us. So I wish all those answers were vetted before they were told on the
Thank you.
Because people are lapping them up.
Yeah.
Yes, Dr. Guleria is doing a wonderful job. He's giving us the right information. But a lot of that information is also very ambiguous because he also doesn't know everything. He cannot answer us everything. So there is, personal experiences are a mixed bag. That's all I have felt about.
Thank you, Dr. Kaul. Now, may I request Dr. Anita Chakravarti? I'm going by the list I have opened from participants. Dr. Anita Chakravarti ji.
Can you hear me?
Yeah, please go ahead.
So, good morning to all. And it is always so very nice to hear Dr. Agarwal speaking on vaccines. I really like that area because it's prophylaxis and prevention, and I have worked a lot in this area. Now, regarding me and my branch, we have been extremely active. And I was at SGT Medical College at that time. And when the outbreak happened in January, by the 3rd week of January, I organized a symposium, and you won't believe it. I mean, people were sitting on the steps also. They were so keen to know what was happening. And I actually literally laughed and told them, why are you so bothered? This is not a influenza virus. There won't be any reassortment. There won't be any genomic changes. There's an envelope, so you can easily use soap and water, wash your hands, etc., etc. And we are going to have May, June coming, and the virus will die. I spoke that way, and things are completely different. We know that. Of course, some things are okay. So since I was working at being in microbiology department, heading it, and being a virologist also, I was very active during this time. And at MAMC, if Dr. A.K. Agarwal sir is there, I remember because of him, I had opened the advanced virology lab for Delhi government. So the setup in MAMC was already prepared. And at that time, I had opened sequencing, and we were doing for dengue and for other viruses, we were doing all those things. So I just wanted to see how things are going to develop with this virus. In the meantime, this being a private institute, they said we want to have people coming from quarantine. Students who are coming from outside, they will be brought here to the airport. So even microbiology has to take an important part. So then we started gearing ourselves, and we started making the various hospital prevention activities started. We started all the symposiums, workshops, hand washing, teaching the nurses, teaching the PGs. But no one was serious. Funnily, no one was serious. We had to tell the PGs about masks, the types of masks, how they should use. In fact, this institute has money. So we even made, all of us were made to make short videos. So we made videos in their, computer section, and we showed how the masks have to be used, what are the benefits, which mask to use when. We were very academically as well as very active in the hospital. But at that time, I think the seriousness was, the impact of this was not really understood. The impact was understood when the lockdown started. So the quarantine, the people would come, the students would come from outside. We were getting a few positive cases. Fortunately, at that time, no deaths occurred, and most of them were healthy. And then after the quarantine, they would go to their respective places. Now, apart from this, what happened was that our association became very active. And because of the activity of the association, because of such a lot of digital drive, we started having many webinars. And in fact, GB Pant, we gave our talks and what sample should be taken. And we had to work hard. Actually, my experience is that I've been reading a lot. I have been learning a lot. And somehow, I should not say, I'm happy the way the fast detection took place. I was pretty happy and satisfied that so many labs became operable. In fact, I was in the SAG for the VDRL when the viral disease research lab started in ICMR. So I was one of the experts. So at that time, Dr. Katoch was the DG. I never expected that those labs would have so much impact. So because it was his brainchild, and because it was developed during that time, and we all sat, we were 3-4 experts, and we sat, we decided what should be done, where it should be done, what are the equipments, what should be handled. Therefore, the diagnosis part of it picked up very well. And there were tests, and of course, WHO was in the forefront, and you had a virologist, microbiologist as the director of NIV Pune, Priya Braham, one of my very good friends, a very good lady, very good scientist also, very helpful. So, ICMR did help in giving many of the things and many of the reagents and helping to make the lab and what should be the basic structure of a lab. And, like homogenizing the testing procedure. And they were all the same procedures doing the various setups. I was pretty interested and I learned a lot. And I also planned and started the COVID lab in SGT. And then actually, both my children are abroad and I'm on my own here with a 90 years mother. So my children, they were very annoyed and they said, you have to sit home for some time. So I sat home for some time for 1.5 months. Of course, I was attending webinars and all those things and keeping myself updated. And then one fine day, I just thought, is it really worthwhile going so far? And when you are at home, I of course went for my walks. I did a little bit of yoga, but I thought that a little bit of negativity comes because our profession is such, we are always active. So sitting for too long at home isn't helpful. Of course, there was one advantage because of the lockdown. No one was coming to work at home. And I think y'all won't believe it. I lost 7-8 kgs because I had to do all the housework and I wasn't permitting anyone to come. And then I suddenly saw there was another place, there was an employment. So now I am the professor of microbiology at Hindu Rao Hospital. So my role changed. But the funny part is when I went for the interview, the commissioner told me, since you're a virologist, we want you to develop the COVID lab. I said, absolutely, I'll develop, there's no problem. But the reaction in the private setup, they said, you have to develop within a week, we will give you what you want. That was the reaction. And in the government setup, of course, the reaction is different. So we are in the process. Now in this whole process, my team, we all sat and wrote a wonderful article It came in the Indian Association of Medical Microbiologists. It was the first article, and the whole journal was on COVID. So this review article got published, and very simple article. And I hope if you all get the time, please do read it. It's interesting. It has nothing to do with hi-fi genomics.
Madam, take
or
the time, please.
Okay. So my whole, I would feel that, yes, there have been ups and downs, and we have lessons to learn. And just like I said, Spanish flu was always there, but we always have history in the books. We never learn from that. However, today we were made to give our names to Delhi government, because Delhi government is taking everyone's name to give the vaccine. I have no idea which vaccine they are going to give. So Delhi government is in the process of vaccinating. So this is all about how I look at this outbreak and what has been my learning procedure.
Thank
It
you.
has not been very negative.
Yeah. Thank you, madam. Now I will request Dr. Arun and then Dr. YK Gupta to share their experiences.
Chalo.
Sir, Dr. A.K. Agarwal ji.
Yes, good morning,
Good morning, sir.
everybody, every friend of mine, every colleague of mine, Dr. K.K. Agarwal and Dr. K.K. Kalra, the main organizer of this wonderful exercise. And my two special colleagues from MC, Dr. J.M. Kaul and Anita Chakravarti. So nice to see both of you and with the smiling faces. Dr. Kaul, seeing you after a long gap.
And me also.
Ah, YK.
Okay, oh.
ये तो you made our day, यार. अब तो दिन बन गया. Anyhow, the question is that Dr. Kalra has requested that to share personal and professional experience. I like to come to personal experience first and then little bit professional experience. Personal experience when the whole dialogue started in February, in March. And I was of a firm opinion that this is like as usual thing, it will come and go. And as Anita said also, I was a believer when the daily temperature will be 45, 46 and everything will vanish. Right? And somehow it did not vanish. Then, you know, the mind always tried to find out what is, then I realized that there was hardly any summer in Delhi this time. It was raining and raining, very few days, it was 45. Then I thought in my mind, there is hardly any summer and that's why it is continuing. And it continued, it continued. There were some waves up and down, but still at that time also I was thinking, well, the numbers are there because we know it very well that the common cold will come and go. And of course, like in past, even in H1N1, there were few mortalities. And we were even in this case, in India, the mortality rate was definitely lower than the H1N1. But then I realized that what is happening in US and the developed country like Italy or Spain, that gave me a jerk. Okay, there is something wrong. There is something wrong. If a country like US having so many numbers and so big number of mortality, I think this is something beyond of what we think. And then I was reminded by my colleagues like everybody and Dr. K.K. Agarwal organizing workshop, this type of meeting. And many of the webinars, then we were reminded of 100 years back in 1918 to 1920. Then I realized perhaps during our lifetime, we have to face this sort of experience. But it's okay. But keeping myself positive, I always felt, and still I'm feeling now the things are coming, going, and still a firm believer that the peak is there and it will vanish very soon. And still I also feel the same way. Regarding professional experience, well, I'm an ENT doctor, but that does not mean that I don't treat officially, but unofficially many people are there. My friends are there to ask me, especially आज नाक बंद हो गई, आज announcement हो गया, आज sneezing हो गई, तो ये तो पूछा ही जाएगा ENT surgeon से, and still I strong. And after sharing the platform with expert like KK every time, and whatever the knowledge I gain, I try to imply with my friends, whether within India, outside India, and try to console them. What I realized that mental stress is the most important factor of this particular domain. And all those who goes into mental agony, they have precipitated symptomatology and perhaps the severity of symptom increase. If you, of course, 1%, 2%, 3% will go into seriousness. But why should we think about 1, 2, 3%? Why can't be 97%? Why can't be 96%? The symptoms will come and go. Age and the comorbidity are important factor. And another thing, since I'm trying to analyze few of the death mortality in the different places, Dr. KK Agarwal, simply there is no simplicity in treatment. We are trying to combine many drugs which are required, not required, because perhaps the expectation of the patient's relations and the family, and now everybody has become doctor. By the time patient comes to you, his son, daughters, relations, mother, father, they know everything. Are you giving this? Are you giving this? Are you giving plasma therapy or not? I was lucky enough to be associated with me and YK when we started plasma therapy in ILBS Bank and all. YK, you will remember that perhaps we were the two in initial most person to give permission for the ethical clearance. Then I realized a lot of expectation, but the outcome was plus minus, plus minus. But there are two important things what I felt, that it is the agony, it is the worry, which is taking us towards a downward curve. And number two is overkilling. We are overloading our patients with the medicine. And this concept of overloading the medicine, in my opinion, is the worst thing what a medical profession can offer to their patient. And number three, that in our medical care, there is, because of circumstances, the doctors are treating them well, but there is no personal touch. There is no personal touch. And that personal touch is lacking. And I wish that personal touch should come. And the patient wants only a consolation, good counseling, and little bit treatment. As regards medical education concerned, yes, it has gone to Dr. J.M. Call will agree with me. Yes. And I wish that medical education should be restored early as possible, so that our youngster, they don't have a 0 year. That's all from my side.
Yeah. Thank you, sir. Dr. YK Gupta ji, please unmute yourself. Yeah.
Namaskar to everybody, and it's a great pleasure to be sharing a platform with Dr. Arun Agarwal, Dr. Kaul, and so many friends of mine. And of course, my thanks to both the KKs, KK Agarwal Sahab and KK Khalraji. So I am always admirer of Dr. KK Agarwal's so many initiatives in taking this. I have listened to all the experts and seniors of mine, and I believe, and which is true also, the COVID, if you just say any rickshawala, sabjiwala, to professional, to vice chancellor, to minister, to president of India, everybody will have some experience to tell you. And that is the percolation of the effect of corona. Public to policymakers to kings, everybody is affected and everybody has something to tell. I will just share 2-3 points here. What Corona has done to us. What I think, number one, it has taught us, and in India particularly, that we need to strengthen our healthcare system. And this has given you the clear direction that where are we weak and where we should put our investment in and where do we need to strengthen our healthcare system. I'm not going to detail because Dr. Agarwal might have talked a number of times on this. And also how much investment we have been talking about, the GDP based investment in healthcare system. And now the government has realized, the policymakers have realized that meager investment of 1.3% of GDP is not sufficient enough. And this is the time. And third thing, this has also taught us that India has the power, the willpower, the capability to rise to the occasion. And this is what we have shown it. We were absolutely short of mechanical ventilators. And now you see so much of the ventilators, ventilator, and starting from the small manufacturers to the large scale, the BHEL to Indian Railways, everybody has started making ventilators. And now we are fully sufficient on ventilators. We had to initially import huge ships used to loaded with ventilators. Now we are self-sufficient in state-of-art ventilators. Vaccine, never could imagine that we could develop a vaccine in such a short time in India, and that too. So these are the three very important things. And the next thing which this has taught to us, repurposing of the drugs. We have large number of drugs and we wanted to always develop a new molecule. How to develop a new indication with already existing drug or already half-baked drugs and repurpose the drug. And now you see maximum projects by DST, DBT, ICMR have been funded for repurposing drug. The next lesson which has taught us, believe in your own strength. And that's why I always admire Dr. K.K. Agarwal. See, we have our Ayurveda, Yoga, Unani, and then suddenly we have risen to the occasion and we have now several drugs today, several homeopathic Ayurvedic drugs, including ashwagandha, giloy, and different type of kadhas and different type of breathing exercises, different type of yogas, which are not only treatment, adjuvant treatment, but also as a preventive or prophylaxis. And that is what we can treat, we can prevent, we can immunize, increase the immunity of the vast population in the country. That is important. We also realize the experience is that never believe in perception, never believe in small experiences. You have to believe in a hardcore evidence. And that evidence is the crux. And that you have seen. There's so many drugs, starting from the hydroxychloroquine to chloroquine, then remdesivir, to up to remdesivir, and so on and so forth. They were entered, and then great hopes, but ultimately when you look into the data analysis, you found that perhaps they are not as effective as they used to be. They're not effective at all, and therefore ultimately the hardcore randomized clinical trial data is important. So evidence is critical. That is what we have taught about. And if I just forget about these areas, now the other important area which we have talked about is the antimicrobial resistance problem, which people have not started yet thinking, because I am the principal advisor of one of the WHO initiative. So much of antimicrobial people have started using, starting from azithromycin, the fluoroquinolone to higher antibiotics, and not realizing that without prescription, without judicious use, we are sitting on another time bomb. We are already handling a bomb which has already bursted. That is Corona. But now a silent time bomb, which is now at the stage of creating a havoc, is the antimicrobial resistance. And this unless we handle this, unless Dr. K. Agarwal, you address this issue, the COVID has given this also a side dimension that is very important thing. The important thing is the pharmacovigilance, which we started in 2010, and now we have a 275 centers in the country. And I happen to be National Scientific Coordinator of that. And Dr. Agarwal has been associated for this, and Dr. K. Agarwal also has been associated. Dr. Arun Agarwal has been. Now, we have to generate evidence that if you are taking hydroxychloroquine, if you are taking remdesivir, if you are taking platelet plasma therapy, what is the incidence of adverse event? What is the risk-benefit assessment? And that healthcare to those who are taking self-care medication. And that requires a very important thing. So now, finally, I would just say one word about the clinical trial. Because myself and Dr. Arun Agarwal have been involved in clinical trial, and you as a NABH chairman, you were also involved in the quality control. This has changed the entire paradigm of doing clinical trial. Conventional clinical trial will be out of date tomorrow. Now, instead of patient coming to hospital for clinical trial, now hospital is going to patient, that is called as a clinical trial, home-based clinical trial, with the help of artificial intelligence, with the help of electronic gadgets. It is the patient's home. You create a data at his home, collect the data, do the reliability check, do the uncertainty check, and do the trial. And also artificial intelligence and the machine learning. It is now tremendous burst of use of ML and AI because of Corona, because the patient cannot go to hospital. There will be unnecessary patient who are already in clinical trial. There will be difficulty in enrolling clinical trials. Majority of the clinical trials is in need of artificial intelligence to reduce the number and get the maximum input and maximum information.
I think some connection loss. May I request Dr. Upasana ji?
Now, is that back? So I just finished.
Yes.
If it is back.
Yeah,
Okay.
please.
So these are the, I think, great opportunities which Corona has given to us, and there is always two sides of the coins. Of course, we are all suffering from the one side of the coin, but we should also be looking at the positive side of the coin, the opportunities, the challenges, and the strength which this has shown to us. Over, and thank you again to Kalra Saab, and thank you to Dr. K. Agarwal.
Thank you, sir.
Good morning, everybody.
Yeah.
And all my colleagues are very senior to me, so they have already talked about all the clinical things. But what I have learned in this journey of Corona, that my spiritual quotient is very high now, because now I have realized there is you never know where this will tomorrow. And our patient needs some sympathy and human touch. So USP of my hospital is that we are going and meeting each and every patient, my doctors, senior doctors, and all staff is going. So in this tough time, what I realized is people need actually some assurance that they will be fine. And WHO is saying that remdesivir is not relevant, but from my personal experience, that we are using remdesivir and results are really good. So one should not believe only on all the declaration by big authorities. One should also learn from their own experiences. So with this, I would like to stop, and thank you very much for this innovative, educational, and very, very good session to Dr. Agarwal and Dr. Kalra. Thanks.
Thank you. Dr. Rai, and then I will request Iraji. Dr. Rai, please. Unmute, please unmute yourself.
Am I audible now?
Yeah.
Namaskar to everyone. Literally, it is a very interesting session because everybody is sharing the experiences which they are facing. And right from the day, I should just count from the 30th of January, when we heard about something, Corona has entered in India, and we all became panicked, but with the hope that with the climate or with the time changes, it will die down. Now I will definitely, WHO being the highest body of the medical profession, could not give us the right picture of this Corona. So everybody was confused whether it is from man to man, it is whether animal to this one. But anyway, we faced that also. And then the things started becoming worse and worse, and the lockdown started. The problems or the agony which we have felt during the lockdown, we never thought in our life that someday we will have to sit in the house only. The person who used to roam in the from one office to other and from one function to other, they were just strict to the house only. But that has also taught us a good lesson, because in the past we were never in the house, and this lockdown has given us chance to live with the family, and we have realized the values of the families also, which were lacking. Now, thanks to that blessing in disguise, we can say. But definitely the life has changed entirely now. What was happening before the lockdown, before the Corona started, and what is happening now, there are a lot of things which one has to learn. There we can speak a number of things there, but all the speakers has given their experience, which will be just overlapping. But now one has realized whatever big person or whatever money you are having is not going to help you at all. A time was there when one was thinking that I can buy this, I can buy that, I can go this way and that way. Nobody was in this position, and everybody was sitting in the house only and enjoying the life. So this Corona has taught us this thing also, that you are nothing in front of the nature. Nature is the biggest thing which can bring you down to the knees whenever they wish. And as far as the epidemics are concerned, pandemics are concerned, I used to read, and not I, a number of all us sitting over here must have read that in the 1918 there was a epidemic, big epidemic, or there was some other epidemic which was localized to one country or to the one state. But this pandemic, Corona, has paralyzed whole world. 193 countries were locked down. Nothing was flying in the air, nothing was on the road, all empty roads were there. Nobody would have imagined if we will have to face all these things, but we all faced it. Now the question comes about this, the role of our physicians, politicians, and bureaucrats. Definitely our friends, doctors have played a very good role when they were ignorant about this Corona, but with their own experiences, hit and trial method. Unfortunately, we will definitely agree, because nobody was knowing what is the role, what is the protocol for the treatment. Somebody was saying this is the protocol. Second day we are listening, this is the protocol. One day we were told these are the sign symptoms. After one week, new sign symptoms has come, because everybody was ignorant about this thing. But time has taught us, no doubt in that. And changing of the protocol day by day has definitely created a lot of problems. And arrangements done in the hospitals, etc., are also very, very commanding also, and somewhere it's lacking. But as a general practitioner, as a medical activist, the worst which I have faced is everybody calling to me, Dr. Sahab, मेरे घर में 3 बंदे मरीज हो गए, मैं करूं तो क्या करूं? उसके बाद calling the doctor, भैया किसी को bed दे दो. Everybody was raising his hand, from where we should give a bed. When in the beginning we were thinking there will be lot of patients, somewhere we have lagged, but still I would say whatever best could have been done, they have done it. The only thing is government has also realized I will not hesitate in saying health was the most neglected subject for the state, because health was a state subject, but nobody was paying any attention. Only 1%, 1.2% of GDP is insufficient, and from IMA level, from all other levels, we were requesting the government to increase
share
it.
your own personal experience, please.
Yeah, that's why I'm coming on that point. And that point,
Yeah.
on that point,
5 minutes.
I'm coming on that point only. So, particularly the personal, our friends, and having these problems, we are helping them, arranging their beds. They are crying also. And the worst part is now the time has come when we cannot meet our own persons. Sometimes we feel very, very bad. Our children are waiting outside and we cannot go and out meet them. But anyway, we have come out of the challenges. Now everybody is waiting for this vaccine. Let's hope for the best. And kudos to our friend Dr. K.K. Agarwal, who has always kept us busy in these seminars, webinars, and others, sharing the information. There are a lot of things which we can discuss in that. But anyhow, experience are a mixed bag. We can say we have disappointed also. At some places, we are happy that we could face the challenges. Thank you very much, sir. This is all.
you. Thank you, Dr. Raj. Iraji, please.
Hello, sir.
Yeah. Good
Hello,
morning.
sir. Good morning, sir. Thank you for giving me opportunity to share my experience about this COVID thing. One thing that I have realized during this lockdown is we have become more internet savvy, and this internet has helped us a lot. As a lawyer, we have seen a lot of changes in our judicial process. Earlier, when the lockdown happened, we all were very scared what will happen to our judicial system, what will happen to our cases. But with the help of internet, and I've seen judges also, the lawyers also, and the clients also coming forward and presenting their case very easily, and it's more convenient than the physical hearing which we see, because it is more convenient to sitting at home. You can do, and things are happening. So lockdown as such, with the help of internet, has not come to a halt. But yes, there are problems which we have faced at the same time, because everything we cannot do over internet, and everything is not possible in our virtual world. There are things which we have to do physically also. But still, with the help of virtual world, we are very blessed. And I have gone through COVID myself. I experienced the COVID also. And one thing I realized when I was suffering from COVID, and my whole family was suffering from COVID, that we don't have to panic about it. We don't have to take stress about it. We just have to simply sit and follow the rules and instructions what Dr. Agarwal has been teaching us since the day COVID has come in this world. And with the help of him, with his blessings, we have survived. And honestly, it was not even a single day when I panicked and I thought कि मुझे COVID से मैं मर तो नहीं जाऊंगी, मुझे कुछ तो नहीं जाएगा. I was not feeling that way. I was blessed. My whole family was blessed, and with the help of Dr. Agarwal, we all survived. And I now, as a COVID survivor, I always, whenever anybody call me up and say कि मुझे COVID हो गया है, मैं क्या करूँ, तो मैं यही बोलती हूँ, बस कुछ नहीं, घर में आराम करो. This is the best time to rest at home and spend time with your family, and just follow the instructions, take medicines, because panic करने से कुछ नहीं होता. But we see in the society, people are panicking and stressing. And Dr. Agarwal and his and HCFI's web series have been very helpful for many people. I've seen myself, and I also recommend them to come over here. So thank you, sir. These were my experiences.
Okay. Now, Sanchita, Dr. Sanchita.
Yes, sir.
This sir will require another 5 minutes. Yeah, Sanchita, please.
Sir, I will just say that this COVID pandemic has, there's a lot of underlying anxiety, there's a lot of stress. And I do miss the freedom to go out without giving any thought to catching an infection. But this virus has also made me realize that there are many things we can do without in our lives, like going to visiting malls, etc. There are many things now we don't need. They're sort of redundant. And I think, and one thing I've learned is I have really honed my cooking skills during this lockdown period. So I'm very happy with that. And I'm trying to strike a balance between my duties at home and my duties at work. So there's a lot to be learned about the virus. There will be a lot of information which is still waiting to be unfolded. And we hope we get over this crisis soon. Hopefully next year will be pleasant for all of us. Thank you, sir.
Thank you. Ritu, you also please share your experience. Ritu? Is she there?
मेरे ख्याल से
नहीं है. Is
फोन
now
करके चाय पीने चली गई
over
होगी.
to you, sir. Now you further lead and share your experience and then further lead the session.
Thank you, Dr. Kalra. Thank you, everybody, for sharing your experiences. In fact, I started this in my 7 p.m. program when I called Mukul Rohatgi to share his experiences. Then I thought we should learn from the experiences of others. I only believe in synchrodestiny, and which is a concept that everything is pre-decided. In synchrodestiny, I did not get admission in Delhi because of I overwrote some questions. So I got it in Wardha. That was the first destiny of mine, where I learned humanity, where I learned public health. And there I topped all the universities all over. And I used to teach for 6 hours a day. I reproduced my habit there, learned my habit of teaching students for 6 hours a day, non-stop, without break. I used to teach during my MD every Saturday, Sunday for 6 hours. Came back to Delhi, was given DM in GV Pant Hospital, left DM, did not pursue DM because my boss, Dr. KL Chopra, said, I'll send you for 1 year for a training in cardiology in USA. So I'm a simple MD medicine, converted into a cardiologist. It was a destiny. And the destiny came at when all the hospitals were taken over by the private sector. And they said MD medicine cannot practice cardiology. All over, DMC, MCI, everywhere there was a wave that a MD medicine should not practice cardiology. So there was a fight between me and my hospital. My hospital said, you will not get privileges of putting pacemakers, giving thrombolysis, which we originated in India. So I left Mulchand Hospital in that particular with a fight with my department, and I said, I'm not interested. It was a destiny that I became, courtesy my colleague, that I wanted to become the president of Indian Medical Association. And then I realized when I became the vice president and the treasurer, that the whole system can collapse you. If they don't want you to work, they will not allow you to work. During my treasurership, because I belong to another party, another group, I was not given any handling of anything. And I did not know how IMA works. For the whole year, I was asked only to sign the checks. Then I realized how important is HSG. So I opted to become the Secretary General. I became, and then the president. It's all destiny. Then I became the president of Confederation of Medical Association of Asia and Oceania. When I became the Secretary General, I asked World Medical Association that if a pandemic-like situation comes, what will you do? At that time, the answer given by World Medical Association was, that is the job of the WHO. Our job is only to make guidelines. So I was disappointed at that particular moment by the answer of WMA. They said pandemics are not our features. Our job is to look after the interests of the doctors. When I became the president of CIMAO, 5th of September, I raised this issue, and one of the basic agenda was how can various CIMAO countries collaborate in case there is an outbreak. मेरे दिमाग में उस वक्त में निपाह था और मेरे दिमाग में उस वक्त में syndrome X था, the disease X, which was coming that India, the world is going to have a disease called disease X, which I mentioned in my speech on 5th of September. And then on 18th of January, I was in Malaysia and Myanmar on the same day. By that time, Corona had come on Thailand. 10th of January onwards, I started writing every day about Corona. We had the first Corona meeting on 18th of January. When I came back, I started writing to government every day. Every day, I have 400 letters which I have written to the government. Every day, not 400. Every day, I used to write a letter, mark a copy to IRA to see whether the government responds or not. And then suddenly lockdown came and I became a household name in media. 10, 15, 13 videos every day coming. Then I realized I'm wasting my time with the media. 1 hour interview, 2 minutes you get. For 40 and 1 hour, 58 minutes you listens to others. And then came an opportunity for me in Hello app, which now has got banned. And I got 1 million viewership every day. With 5 million people became my subscribers. So I started educating. Then suddenly I got to know India is going to ban the Chinese vaccine. I shifted to YouTube and Facebook. And today I have 6 to 7 lakh subscribers in various social media. I shifted myself to education. That's a big change in me because I always loved education. Say, for example, today I'm interacting for 10 hours today. Till 10 o'clock, I will be interacting. This is my 4th session. So for me, the change is that if you love your profession, if you love teaching, the God will give you someday of your life, it will give you teaching. And for me, for the first time, I'm realizing that I'm born as my passion is teaching, whether public or doctors. You should continue your teaching. And my purpose of becoming doctor was this pandemic. It's an opportunity. I took it as an opportunity. Today, I have 1,104 hours of interactions I have done. And I've made 5,000 small videos, which are circulating all over. My passion for media, for other things, for recognitions, for awards, everything has gone. Nothing is there in my mind that I'm doing it for every time we used to say हमें कुछ किया है तो award नहीं मिला, used to collect कि हमारे को ये मिल गया, वो मिल गया. First time I'm realizing what humanity is, and the humanity is to look after others, which I'm doing by my shows every day, where a public comes back and say मेरी जान बच गई, या आपके प्रोटोकॉल से, आपके पढ़ाने से हमारी जान बच गई. That was the purpose of my life, for which I became a doctor, and I think I'm doing justice to my profession for the first time. Thank you. Dr. Kalra now.
So I think already we have crossed 15 minutes. I think most of the people have shared their experiences, and initially everyone has taken it lightly, but as disease progressed, more and more cases came, then seriousness came in, and everybody has faced the challenges of restrictions due to the lockdown. And good things is not only challenges, difficulties they face. This has given a good opportunities for learning to all. So, which was earlier thought not possible, but COVID has taught us and shown us the way forward, the use of technology, the artificial intelligence. And also it has cut down the unnecessarily our expenditures or even travels, because of the travel restrictions or ban imposed. Now we are finding all scientific conferences, webinars, and workshops successfully are being organized online, digital platforms. So definitely it has given a lot of opportunities and prepared us. Now almost we have come out of this COVID crisis. It seems that everybody is expecting a vaccine. Probably all are waiting for the vaccine, and how much effectivity and how, but that was the time will tell. But at least patience, that everybody anxiety and fear is, I think, going to be subdued in the next end of this month or next month. And whatever learnings we have taken from this episode, We must practice all the good things, and definitely it has taught us, the policy makers, how to prepare, especially the emphasis in India. As Dr. Gupta said, the government now is very well prepared, and they are thinking the need for serious inputs, financially, otherwise also, into the healthcare system. So I think we are now well prepared to meet any other challenge in future. It may come, nobody knows. As Dr. Agarwal has said, for him, this COVID has given a of a lifetime. His passion, his passion was to become a teacher or a educator, and he has got success during this COVID crisis. And humanity, definitely, this COVID has taught us humanity. We must look after others with full. With these words, I will thanks everyone, all the participants, for attending this interaction today. And over to now Dr. KK Agarwal back.
KK आज महेश वर्मा नहीं है?
नहीं, वो आज गुवाहाटी के वेबिनार में है.
अच्छा अच्छा.
I think we are because this does not require a sum up. Let me thank everybody for and keep joining us, keep passing on the message. It's a forum where we learn from each other. I have learned a lot. I'm learning every day. And the best thing I learn is if I teach, I learn more, because then I realize what did I miss, and I learn from my colleagues. I think it's an opportunity to learn from each other and continue. This disease is not going to go. Vaccine is not going to be the answer. All of us ultimately will have to face the music. Our job is to make the disease as mild as possible by wearing a mask. Thank you, everybody.
Thank you.
Dr. Kalra. We'll be back next week.
Thank you very much. Thank you very much.
Thank you.
Okay.
Thank you very much.
Bye all. Bye bye.
Thank you.
Bye-bye.
Bye.